University, from the School of Public Health, the Kennedy School of Government, where he learned some of the same organizing skills that we're learning here today, as well as Harvard Medical School. So Dr. Ruiz is an emergency room doctor and has also led various public service and humanitarian initiatives until he was elected to the U.S. House of Representatives in 2012, where he represents California's 36th district. We have a lot of Californians here today. And Dr. Ruiz serves as on the House Energy and Commerce Committee and the House Veterans Affairs Committee, and he's also the chair of the Congressional Hispanic Caucus. So again, we're so grateful for you to join us all today. Dr. Ruiz, thank you for being here.
Thank you, Nick. Thank you for that introduction. It's good to be here. You're absolutely right. I think I'm the only PIHer in Congress, and possibly the first. I'm not sure, but definitely you can count me as a PIHer. When I was in medical school, Dr. Paul Farmer was my mentor, Jim Kim as well. And it was a sad reunion, but it was important to get together with the PIH family to mourn the loss of Paul Farmer. Nonetheless, his legacy continues in every single one of you, in you doing this program and your strong devotion to learning how to organize and how to make structural changes to alleviate structural injustices and violence against the poor around the globe. And there's so much I can talk about my experience and what I've learned and how I apply the PIH way and what I do now as a congressman and also chair of the Congressional Hispanic Caucus.
You certainly are the first PIHer in Congress, and though we hope you're not the last. You've been such an incredible leader and supporter of all our work, and we really want to learn from you about how we can effectively advocate with our own members of Congress, because that's something we're really going to be focusing on throughout this year and our lives, but particularly next week. We have a really big push. But before we get into that, you alluded to this, but I was hoping that you could share just a bit more with us about your own path towards advancing equity and social justice as an activist, physician, PIHer, and member of Congress.
Well, you know, I live the experiences of social injustice. I grew up in a poor farm worker community in the city of Coachella. Many of you know Coachella as the music festival. But the music festival is actually in the city of Indio, and the neighboring city is the city of Coachella. So the city of Coachella, I believe, has a median income of maybe about $28,000 to $30,000 dollars a year. It's very impoverished, very under-resourced. It's mostly farm workers. My parents worked in the fields growing up. It wasn't until my dad was promoted to work in a packing house that we were able to move from our trailer park and into the home where my mother still lives. My older brother was the first to graduate from high school in the whole family. Then I graduated, then he went to college and I followed. I went to college as well. And I always had a very strong sense of determination to fight for health and social justice. I knew I wanted to be a doctor since I was the age of 4. And I always said I was going to be a doctor and come home and serve the community. And I learned community organizing and activism in the School of Hard Knocks. I went to UCLA undergrad and did a lot of community organizing and activism there as a student leader. And I graduated magna cum laude, went to Harvard Medical School. And so you can imagine being a grassroots organizer and activist at Harvard Medical School. I had long hair at the time and I wore my bandanas. So those were different times, but nonetheless, the mission is still the same. And that's where I met Paul Farmer, and that's when I got involved with PIH. And I really, transitioned from a non-strategic, heartfelt activist to a professional academic activist and organizer. And that's one of the things and the lessons that I learned from Paul and Jim and the PIH family is, how do I take my education as a physician and the research skills in academia and apply it on the ground? So it's one thing to know the problems and know it well and go down break open some doors and get inside and shout, you all have to do something about these issues. There's another thing of learning how to develop strategy and implementing it and persuading and getting the resources and getting the and developing the organizations to actually address the problems that you're trying to do, that you know of because of the research that you've done. And so that's the part that I really transitioned into, not only with Paul and Jim, but also in my education at the School of Public Health at the Harvard Kennedy School, and also the School of Public, the public policy at the Kennedy School and public health there at Harvard. And I came back home fueled with all these skills and motivation, working as an emergency physician, and I started community health projects and programs. I started a free clinic in the farm worker community. I created a mentorship program with kids who wanted to serve in underserved communities and had the same mission for health and social justice. I led free community education campaigns in trailer parks and vaccination programs. I was recruited to be founding senior associate dean at a startup University of California Riverside School of Medicine, where they incorporated my future physician leaders mentorship program into their School of Medicine. I helped develop residencies in teaching clinics and federal qualified health centers in poor communities so that we can really expand our training into those communities. And then I had this crazy idea of running for Congress. Never held office before, never ran for office before, never even participated in a campaign before. I think as a doctor, I contributed some money to Obama's campaign, but that was about it. But with the can-do attitude, I said I was going to extend my fight for health and social justice beyond the emergency department and continue in the community, but in a more structural way through policy, where I can help advocate through the federal government and the resources and the budget that the federal government has for our underserved communities. And I won, and I sit on the Energy and Commerce Committee and the Health Subcommittee, and the Environment Climate Change Subcommittee, Oversight Subcommittee, and the Veterans Affairs Subcommittee as well.
Well, we're so glad to be, I think, both inspired by your path and the example that you've set, and also to just have you as a continued champion for the long haul in Congress. So thank you to Representative Ruiz. And on Monday, all of us here and others as well will be meeting with our own representatives and their staff to discuss the Paul Farmer Memorial Resolution to end preventable deaths in low-income countries. Legislation that originated out of conversations like the one that we've been having over the past months since Dr. Farmer's passing, about how to fully honor his legacy and do so through legislation. And so we know that this is going to be a long-term effort, and will take building strong relationships with our own congressional offices. And we also know how key and important it is to really be effective right out the gate with these first meetings we're having just this coming Monday. So I'm curious to hear from a member of Congress yourself, what advice you have for us on how to advocate effectively with our representatives to advance this bold, equity-focused legislation.
Great. Well, I'm going to give you a big overview, right, of how do you talk to a congressperson. And I'm assuming many of you come from a public health background, pre-med, or want to do things in some kind of STEM field. And oftentimes when people from a STEM background come in, they want to talk about data, and they want to show the latest research and why it just makes obvious statistical significant sense. And people throw down fancy words like the p-value and confidence intervals and all these things, why we need to take care of the poor and why we need to spend billions of dollars in certain funds, etc. That's one mistake that those of us in the public health world make. The second mistake is that we come in and we build up our argument like a PowerPoint presentation of a research study, where we do our background, why we're doing this. Then we do our methodology. Then we do our results, and then we do our conclusion. And by the time we go through the entire presentation, you have about 2 minutes left, and then you make the ask at the very end, and it's rushed and it's not really focused on the ask, and then you leave, and then you have to go. Right. And so that's the second mistake that individuals make. The third mistake is that they don't really get to know or do the research on the member of Congress. What are their interests? What's their background? What's their previous employment? Why would they care about this issue, and why it's important for them? And what I mean by that is, it's primarily their district and their constituents, right? But it's also, why is it important for them politically? And because, members of Congress are always thinking about, oh, is this good for me politically to get reelected and all of that. And so, so the way you combat that and those different advice is, members of Congress are like anybody else. They think with their heart, and their people. So you want to connect with them. And the way you connect with them is through stories. So one is, first of all, don't be disappointed if you don't meet directly with the member of Congress. Count yourselves very fortunate if you do meet with the member of Congress directly. More than likely, you'll probably meet with the staff, but that's okay, because it's the staff that eventually speaks with and advises and recommends and signs off and presents the piece of legislation that you're advocating for to the member of Congress. And so know that's okay, and that's part of the system. And then you work your way through it. The second thing is, you tell your stories. So one, somebody wrote The Story of Self. I was trained by Marshall Gans in The Public Narrative, Story of Self, The Urgency of Now, and The Story of Us. I don't know if you guys, I see some smiles, so I think some of you are familiar with it. And so I think it's important, do a quick introduction, but make it focused of who you are and why do you care about this in your personal story, right? Don't just give your life history and take up all your time, but who you are and how does it relate? Tell a story about you that makes you care about this issue, right? Then you give the urgency of now, right? How many people are dying? How many people are affected by this? What's the difference that we can make? And then you tell the story. In this case, it's the House resolution in memoriam of Dr. Paul Farmer. Talk about Paul Farmer's life. Talk about, look, this is a guy that grew up in Florida in a school bus, and his whole life, devoted himself to fighting poverty and social justice. He was Jesuit. He was trained with the Jesuits, and then he at Harvard Medical School, he developed Partners in Health. Why? Talk about all the barriers that he broke and what Partners in Health is and what they're doing now all over the globe, and tell his story. Basically, make them feel for Paul Farmer and what he was able to accomplish and still does, and what his life mission is. And so, inspire them through your story connected with Paul's story, and then what we can do as a country to make the biggest difference to carry on his mission. And then I think that's how you're going to reach them more than statistics, more than what's the latest rate of HIV in different countries, because they're just going to zone out. They don't even know the HIV rate in their own district, right? So, and they don't have even a rate of comparison, or TB or malaria or any of the other illnesses that PIH deals with around the globe. But the more compelling the story, the better it will be. The second thing is start with your ask up front. Don't wait. Don't wait. Don't build up to it. You say, hi, I'm so-and-so. We're here. This is our group. The purpose of this meeting is to ask you to be a co-sponsor of House Resolution in Memoriam of Dr. Farmer, right? And then I'm going to talk to you about why I care. I'm going to talk to you about who Dr. Farmer is. I'm going to talk to you about what's in the resolution and why it's important. I believe it's important for you as my congressman to support this resolution that I believe would be very, very helpful for the cause, right? So it's almost like the first page of a PowerPoint presentation where you start with the conclusion and then you tell them how you're going to go through the presentation. And then you can go, and if you have multiple, you can even lay it out and say, okay, this person, this person, this person, this person. Why is that important? Sometimes when I'm in the room and people are presenting to me, and I'm talking about with professionals, who supposedly do this for a living, they come in and as they're speaking, they're giving their introductions, they're talking about the problems, they're talking about all this. And in my head, I'm thinking, where is this going? Where is this going? Who's going to speak next? How much time do we have? What is the ask? What are they going to ask me? And when you start with the ask and you lay out how this presentation is going to go and the time frame that it's going to go in, then they're thinking, oh, they're going to ask me this. So now they're thinking, why should I support it? Yes or no, right? Why is this important for me? Yes or no, right? And so then throughout the whole presentation, they're starting to think, okay, do I support this? How is this going to help my district? How is this going to help that? Instead of where is this going? What is the ask? And then at the very end, people make the ask and they're like, oh, okay, we'll think about it. But then, you have 10, 15 golden minutes with the decision maker in that office. If you meet with the member of Congress, but it doesn't matter. It's always practice like you're meeting with the member of Congress when you meet with the staff. And then at the end, you make the ask. Okay, again. And so your conclusion is also very important. So you say, so you see Congressman so-and-so, you've heard our stories, you've heard why this is important for us. You heard the remarkable story of Dr. Paul Farmer and this resolution, and you understand why we care about our responsibility for global health, and why it's important for your district, for our district, for my family and our community. And that's why I'm asking, can you co-sponsor House Resolution in Memoriam of Dr. Paul Farmer? And then stay silent. Make the ask and stay silent, and make the hard ask, and then wait to see what they do. Don't leave them off the hook. Well, just at the end, and then chances are they'll say, "Oh, thank you for asking that. I'm gonna, I'm gonna review this in more detail. I'm gonna look at this. I'm gonna, I'll get back to you." And that's okay. But at least you made the hard ask. Now, that's if this is the only ask you make, right? If you have multiple asks, then you want to, the same process. We're going to ask this. We're going to go through all of the different asks, why it's important to us, why it's important to you, why it's so urgent. And then at the end, you can say, can you co-sponsor these different bills? And then you just list them, as well. And so that would be a framework of a good presentation for a member of Congress. Was that helpful?
My phone is blowing up about how tactically helpful that was and inspiring. Thank you so much. I love that. So drop the PowerPoint, ease up on the stats, start with the ask, lay out the agenda and tell that story. Consider who you're meeting with, do the research beforehand of the representatives, their own background and also their political interests, and then just make that ask, that hard ask, and then just wait. That's just such incredible advice. Thank you so much, Congressman. Do you have any I know you have an incredibly busy schedule and have to go soon. Any closing thoughts or words for all of us?
Yeah, one is, don't underestimate the power of a good story. Okay. Don't underestimate yourselves being young and students. And don't underestimate the power of relationships, right? So so this would be a good way to start building relationships. If you like your congressperson, you can always volunteer for your congressperson. If you can maybe do an internship for your congressperson. You can get involved in that way for your congressperson. And always make yourself known, because like I am still mentoring interns, and interns in my office have a very soft spot in my heart. I like to see them grow, professional, etc. And I consider them still part of my family. And so if you're thinking long-term, and how do you influence members of Congress long-term so that you're in their head, but more importantly, you're in their hearts, then be around, volunteer, help them out. Now I understand some of you might have representatives who are extreme right-wing, and don't want to spend a dime on the poor, which is contrary to our mission and our fight. I would still make the ask. I would make no assumptions, because you can still connect emotionally with them through your story and the story of Paul Farmer. Obviously don't be judgmental. And you might not want to volunteer in their office or their campaign, but you could always invite them to your project. You can always invite them to tour, some community work that you're doing, and they'll go if there's press. So if you know how to work the press, they'll go where there's press. They're like Nance with lanterns, right? They see light and they'll go. They see cameras, they'll go. So if you devise something like that to get them, that's another opportunity for you to have them see the story of health and social justice that you're working in. And that's very important. I'll take Nick, if you want, I'll take a couple questions.
Oh, I'm sure that would be so great. Thank you so much. Yeah, anyone, feel free to raise your hand if you have questions for the congressman. Samiha, please.
Hi, Representatives. Thank you so much for speaking with us. It's really funny because I actually saw you speak earlier with Senator Barbara Boxer, because I was in a seminar with her at USC. So it's very exciting to see you again. But my question was for individuals who have representatives. So we're in college and we're abroad, across the United States, and not anywhere close to representatives right now, but we still vote within our district. How to really build those relationships? Like you mentioned internships and volunteering with them, but I can't do that when I'm still in college or far away, but I would like to help. So what are some opportunities where we can continue to build relationships with the members of Congress, even if we're farther away from them?
So your summers, of course, you can go in and meet them or volunteer or do a summer internship. Some universities have programs that provide stipends or the ability to leave school and do an internship on the Capitol. I know that the UC has a program called UCDC, and you can get to know the congressperson who represents the area you live at right now, even though you're probably registered to vote in a different district. You can still participate. You can still meet with them. You can tell, I'm a student in this university that's in your district. That's good too. Members of Congress like to see the youth engaged. It's like a sweet spot for them. So so I wouldn't limit yourself because you're in a university away from your home district, because there's a representative who represents that university as well. And there's other opportunities for you to still go and work with or visit your hometown representative. So what's important and important for members of Congress, obviously, is if you're a voting constituent of theirs. And so you can always go to your hometown congressperson when you're in DC and say, you're my congressperson, I'm studying at this university, but I'm here because I want to, I have a very important issue to talk to you about.
Thank you.
You're welcome.
And I think Sadia had a question. Sadia, do you want to go?
Yes, thank you so much, Representative, for joining us. I had a question about how we can follow up with offices after we've made that hard ask and had that initial conversation. How do you make it up to become a priority for a representative?
Repeat that last part of the question again. I was trying to find you on this screen.
Let me raise my hand so I could maybe show up. Yes, my question was, how can we best follow up with an office after we make that first hard ask in a meeting? And from that, like with the follow-up, how do we make it up to a congressman's priority list and something that they're really going to consider?
Yeah, that's the $1 billion industry question, right? That's what the whole idea in Washington DC is about, is how do you make their issues a priority for that person? That's where the follow-up is very simple. You call them, call them back, call that staffer up and ask, when you leave and they say, okay, we'll take a look at this, don't just leave it vague, because staffers are extremely busy as well. Say, okay, when do you think that we can follow up with you to get a response? That way they say, okay, call me in 2 weeks, call me in 2 months, call me in 3 months. Or if they say, don't worry about it, we'll call you when we complete it, don't accept that. Say, okay, I'll call you in 2 months. And just call them back up and say, hey, any updates on the co-sponsorship of this? And then just keep sending them data or sending them the resolution or sending them stories of a patient that PIH has taken care of, or a patient that has recently died because of poverty in a different country. And hey, look, I just wanted to share the story about this person in Rwanda who died in one of our clinic because they didn't have preventable, easy antibiotics. She was a 17-year-old, full of life, wanted to do this, and now she's gone because of, the inability to get amoxicillin or whatever. And so, that's why this is important for us. Can you really, can you take another look at this and see what you think about this House resolution? A House resolution shouldn't be very difficult, because a House resolution isn't a bill. It is a sense of Congress. It's an opinion. And those are usually easier for members of Congress because they're not committing money to anything right now. It's just an opinion. But as I understand, it's the persuasion tactic of getting to yes by first getting your foot in the door for them to accept the idea, and then you can get to yes. And then later on, you'll go back and then you'll have a bill which will actually vote to increase monies to certain programs. In terms of making it a priority, you got to know the person's district. This is where the politics come in. If there's a major crisis that's in the news, or if there's a major salient issue in their district that has pertinence to this issue, then that's when you can step in and it goes higher in their priority list. If it is in relation to something that will help them get reelected, that's very popular in their district, then it raises in the priority list. Or if it's a personal mission of the member of Congress, like they ran on this, or their sister, you know, had died of this, or something like that, then it becomes a higher priority for that member of Congress. So you'll just have to understand the district, the politics, and that member of Congress to try to get them to prioritize it. And I think right now with monkeypox, with COVID, with, you know, we're in the time of pandemic, we realize that global health is global health security, and it is national security for the US. So the best way that we can contain communicable infectious diseases that can become epidemic and pandemics is by treating them on site, you know, and therefore, if we can invest the monies and provide the quality care and the treatment for the poor in their home country by developing infrastructure and the care and the services, then the better we are at preventing the spread of communicable diseases. Now, you might say, well, what about these other that aren't pandemic level kind of illnesses? Then, you know, at that point, I would still talk about, well, at that point, you talk about, you know, in my opinion, the moral imperative.
Thank you so much for that.
Thank you, Congressman. Are you able to take a couple more questions?
Sure, two more, and then I gotta run.
Thank you so much. Sophia had her hand up, so we'll turn it over to Sophia.
Thank you so much, Nick, and thank you, Representative, for coming today. I didn't look at the agenda beforehand, so this is a really cool surprise. You mentioned earlier that college students can still kind of work with the representative of the district their school is in, even if they're not necessarily voting in that district or constituents of that district. Do you have any recommendations for approaching that, especially if the representative is not as likely to be on board with this, if they're a little bit more conservative?
That's going to be like a personal choice for all of you, right? I think that you know, I'm not recommending that you go help and get that person elected, because there may be somebody else that person is running against that is more in line with the mission. So that part is going to be a little tougher. So I think understanding who, leveraging his interests or her interests by leveraging people that he sees as an asset to his campaign. So there could be conservatives in the university, deans, professors, and those members of Congress also want to show that they're supporting students in the university there. So figuring out a way to advise and to be in front of that member in any capacity that you can is, I think, going to be the best way. Now, if there's a member of Congress that is, you know, believes in health and social justice, that believes in global health, then by all means, volunteer in their campaign, you know, go to their office, help them out. You know, you can find, and by the way, when you do these different internships from your university, you're not limited to your hometown congressperson or the congressperson in your university. I have many interns in DC through different programs, the Panetta Institute, the UC-DC Institute, and others who are from different parts of California, maybe even different parts of the nation. I just have just right now, Julia, who is the daughter of a friend of mine from Harvard Medical School. And there's, some that are from LA, San Francisco, USC, Stanford, other different places that are in a school program in my office. So you're not limited to, you can still get that experience with that member of Congress in DC.
Thank you.
Thank you so much. I think Tram has a quick question, and then we can just do one quick last request to close out.
So my question is, I wanted to get your opinion on whether we should focus advocacy efforts locally rather than nationally. Like if a certain policy is definitely supported by your representative, would it be better to focus your efforts on trying to change the minds of other Congress members who are on the fence about that policy?
So I'm trying to figure out, is there two parts to that question? The second part is, should you focus on people that are more inclined to support the policy so they can get on there and kind of prioritize less members that may not be forthcoming for this policy? And then the other was, should we advocate on local issues in the district?
So it's should we advocate for the it's the first part, and then should we, instead of focusing on the representatives that support that policy, should we focus our efforts more on changing the minds of Congress members that are on the fence about that policy instead?
Okay, so that's a very strategic question. So what you want to do ultimately is to get this resolution on the House floor for a vote. So the House of Representatives will pass this resolution. The person who decides what comes up to the floor is the Speaker of the House. That person has the authority to say yes or no. Okay, that person right now is Speaker Pelosi. And you all have an advantage because Speaker Pelosi knew Paul Farmer, adored Paul Farmer, and understands Paul Farmer. So the more we hear from all of you directly to the decision maker, in this case, getting this House resolution on the floor, I think that is strategic. Then the other person, then the way that you can help convince that person is by showing that you have a lot of members in support of this bill. And that's where you go co-sponsors. So it's a numbers game. And when you go to the Hill, you want to focus on the lowest hanging fruit. So yes, go to the folks first, get them on the Hill to support this resolution as quickly as possible. So you build up your numbers. Then I would also suggest that you look at Republican representatives who have a record of supporting global health issues, and then go to them. Maybe Republican representatives that have some kind of tie to Paul Farmer's story, whether he grew up in a certain area, whether, even if maybe one of Paul Farmer's relatives, a sibling or his mom, where do they live? Are they represented by a member of something that connects the Republican to this mission and to Paul Farmer, right? Then you can you can make it bipartisan. Making it bipartisan gives it more weight. So that is where I would start strategizing and focusing on it quickly. I do think that this is a resolution that I support. I know that I support, and I know that I'm going to help you get co-sponsors with other colleagues as well on the House floor. And the fact, that Jan Schakowsky is carrying it, I believe, she's a senior member and she's in the Progressive Caucus. So she could, focus on her colleagues in the Progressive Caucus and get co-sponsors in that way as well. And look, what I'm telling you all I'm going to follow my advice, right? When I speak to members of Congress, I'm going to say, look, I'd like you to co-sponsor this bill named after a mentor of mine. Let me tell you my story and how I met Paul Farmer and why it was important for me. And let me tell you and the influence he had in my life and on this issue. And then, and in my experience in Chiapas with PIH and the jungles of in southern Mexico, and let me tell you why this is important for you to sign on and why it's urgent. The whole same framework I'm going to use on my colleagues as well.
Thank you.
Thank you so much, Representative Ruiz, and we could not have a better partner, and we're so excited to partner together in this campaign. I think just as we close out, I wanted to put at least one piece of your advice into practice and practice this approach with you, specifically the direct to ask. So here we go. Congressman Ruiz, would you be willing to take a photo with us to close out this session?
Yeah, sure, of course. Yes.
Thank you so much. I think Sam's going to take the screenshot. So if everyone who's able to put on their cameras, please do, and we'll take this multi-screenshot photo. And I think we'll just keep smiling, and Sam, let us know when we're good. All set?
I could only get one page of people with the congressman, but unfortunately, but we have one.
We might do some editing there. Thank you so much, Congressman Ruiz. We're so excited to partner on this campaign.
Thanks, guys. Thanks for all the work that you're doing. And truly, you all are an inspiration. So keep it up, okay? Bye-bye.